Hello everyone, this is the continuation of the previous lecture. In this section, we will explore the key concepts related to the thyroid hormones, including T3, T4, and what is the reverse T3. We will discuss what Deiodinase enzymes are, how selenium level influence their activity, and understand the physiological basis of sick Euthyroid syndrome. T3 and T4 synthesized from the thyroid follicles and are released in the circulation by the action of thyroid stimulating hormone, which is released from the anterior pituitary. The T4 is more abundant than T3. The approximately 85% of T3, which is present in the blood, is produced by T4. It is more stable than T3. It is more stable than T3. And the T half of T4 is around a week. T4 is regarded as the pro-hormone because it has to convert to T3. T4 has to convert to T3 to have its action. The deiodinase enzymes helps in conversion of T4 to T3, which is present in the peripheral cells. We have different type of deiodinase. We have like deiodinase type 1, deiodinase type 2, deiodinase 3. Deiodinase type 1 and 2 are also denoted as D1 and D2. And T3 is the more active form than T4. The half-life of T3 is around 18 hours. Suppose we have a cell and T4 enter the cell. In this cell, there is a presence of deiodinase enzyme. This is the peripheral cell. T4 is then converted into T3 with the help of enzyme deiodinase type 1 and 2. So deiodinase type 1 and 2 helps in the conversion of T4 to T3. That is the more active form. Suppose we have too much of thyroid hormone in a cell, that is too much of T4. And then this increased level of thyroid hormone is then handled by deiodinase type 3 and convert the T4 into a reverse T3. This is the reverse T3, which is the inactive form. And that's how the cell handle the excess of thyroid hormone. T4 enter into the cell, it convert into the active form by the help of enzyme deiodinase type 1 and 2. And if there is excess of T4 present in a cell, then the deiodinase type 3 converts the T4 into the reverse T3, which is the inactive form. Important point regarding the deiodinase. Selenium is the integral component of this monodeiodinase, especially type 1 and type 2. As the selenium is the integral component of monodeiodinase, thyroid gland contain more selenium per gram than that of any other organ. The selenium improves the conversion of T4 to T3, especially in patient on levothyroxine. Suppose in patient on levothyroxine. Those where the persistent hypothyroid symptom despite normal TSH. So selenium supplementation, that is 100 to 200 microgram per day, support the D1 and D2 activation and improve peripheral T3 production. So selenium improves T4 to T3 conversion, as it is the important component of deiodinase, and deiodinase helps in conversion of T4 to T3. Deficiency of selenium result in reduced conversion of T4 to T3 and decrease the monodeiodinase activity, especially monodeiodinase type 1 and type 2. And this leads to low T3 level despite normal or even high level of T4. As there is decreased the conversion of T4 to T3 leads to increased level of T4, and this T4 is then converted to reverse T3. Then this increased level of T4 will then convert into the increased level of reverse T3. So increased level of reverse T3 due to increased T4 level. The reverse T3 is worsening the hypothyroid symptom. So selenium deficiency mimic functional hypothyroidism at tissue level. Now this is the right moment to address a key concept, and let's discuss it with the example or with the case scenario. A 55-year-old woman is admitted to hospital with acute pancreatitis due to gallstone. She has been in ICU for 3 days with ongoing vomiting, fever and hypertension. The past history include obesity and hypertension. She is not on any thyroid medicine. Due to lethargic and prolonged ICU stay, her physician ordered a thyroid function test. And this is the test result. The TSH is low and T4 is low and T3 is also low. Cortisol level is normal. Now the question is, what is the most likely explanation for this patient's abnormal thyroid function? So let's table this for now and understand. If a patient is critically ill, or patient with any systemic illnesses, or if the patient is fasting for a few days, or in ICU setting, in these cases, TFT should not advised. Why? Let's discuss. What happens in this case if the patient is seriously ill, or patient is fasting for a few days, or if the patient is in ICU setting? In this case, what will happen? There is temporary inhibition of deiodinase type 2 and activation of deiodinase 3. So what will happen with this inhibition and activation? With this previous topic, we can understand that if there is inhibition of deiodinase type 1 and if there is activation of deiodinase type 3, then what will happen? If there is inhibition of deiodinase type 1, there is decreased conversion of T4 to T3. And what will happen with the activation of deiodinase type 3? There is increased conversion of T4 to reverse T3. So with the inhibition of deiodinase type 1, there is decreased conversion of T4 to T3, and with the activation of deiodinase type 3, there is increased synthesis of reverse T3. So in this case, what will happen to the level of TSH, T4, T3 and reverse T3? In the early stage, there is normal TSH and normal T4. Because the conversion of T4 to T3 is decreased, there is decreased T3 production. And because of activation of deiodinase type 3, there is increased level of reverse T3 initially. This is early stage. In middle stage, as there is decreased conversion of T4 to T3 because of inhibition of deiodinase type 2. So in the middle stage, there is still decreased level of T3 and there is increased level of T4. Because of decreased conversion of T4 to T3, there is build up level of T4. So increased level of T4. These increased level of T4, there is decreased production of TSH by the negative feedback mechanism. That is, increased level of T4 inhibit the release of TSH from the T pituitary by negative feedback mechanism. And because of increased level of T4, there is increased synthesis of reverse T3. So what will happen in the middle of the stage? There is increased level of reverse T3. In late stage, because of rapid catabolism of all hormone, there is decreased TSH level, decreased T4 level, decreased T3 level and decreased reverse T3 level in the late stage. So if a patient is critically ill, if he or she fasting for few days in ICU setting, the TFT should not advise, as it inhibits the deiodinase type 2 and activation of deiodinase type 3. And what will happen in the late stage? There is a rapid catabolism of all hormone, that is TSH, T4, T3 and reverse T3 level are decreased. This is what we call sick Euthyroid syndrome. This syndrome is due to the release of interleukin, release of cytokines, because of release of these inflammatory mediator and lead to catabolism of all the hormones. So let's back to this case. Because of ongoing systemic illness, that is acute pancreatitis, and there is a release of interleukin cytokines, that is inflammatory mediator, and result in decrease the level of TSH, T4 and T3. So the explanation for this abnormal thyroid function is this Euthyroid syndrome. Usually in this case, we do not initiate the thyroid hormone therapy. Thyroid function will normalize with the recovery from this illness. The only treatment is the treatment of underlying illness. And this is sick Euthyroid syndrome.